All right.
Got it.
All right, everyone. So I'm going to give this awesome speaker just a brief introduction because there's a lot that could go behind his name. But this is Dr. Steve Capobianco, and he was pretty influential in my schooling. He came in and as a young doc, taught us all about fascia and connective tissue and how to think differently and ask different questions that maybe we weren't exactly taught to ask those types of questions. And it's helped me evolve into being a better doctor and provider and coach. And not only is he the medical director of Rocktape, but he has done some really awesome things through that company and other companies. And so we're going to have a discussion today on pain and pain science and interoception. And this is a newer concept for me, so I'm super excited to also hear about it, as I just was reading a book that talked all about it. But Steve, I'm going to turn it over to you. And if you guys have questions, you can either chime in or pop them in the chat as we go.
Well, listen, I'm ecstatic about the opportunity to talk about what I think you and I have been slowly learning more about over the last, let's say, 10 years of my career. And I'm not sure how long you've been looking into this, but ultimately what we're finding is that pain is complex, that we are complex as human beings. And we've been attempting to solve a problem in a mechanistic way, saying that we're machines. And machines are not complex, they're complicated, but they're not complex like we are. So we're kind of using computers and using vehicles and other machines to kind of say that we fix these things with these types of tools. We should be able to do the same with humans. And I'll share a personal story of why I needed to start to evolve my mindset and how I treat my patients and clients and how I actually interact with my own body. And so I'm hoping that those who are listening can actually relate. But I've always been a mover, and I had identified as someone that was always active, fit, or wanting to be more fit. You know, whatever I thought of myself, movement was a component of that. And my handle now, which I don't even like sharing, but is the movement advocate, because what I feel, if I look back of my entire life, I've always been advocating for moving my body and moving with others. And so I had a shoulder injury, a pretty significant shoulder injury, and the experience of the injury and the follow-up from that, following a pretty radical surgical procedure to repair it, took that away, in essence, from me. The actual gift of being able to move through space. And so I went through a pretty significant depression, and I was holding this back from many people, especially those in my professional circle, because I felt almost ashamed that I was the expert, quote unquote, and I couldn't even fix myself. And the part that I wasn't able to interact with, I had every tool that is available. And I'm a gadget guy as well. Doc knows this, that I like using all the tools to help someone move more effectively. So I had tape, tools, elastic bands, electrical stim. I have, pulsed electrical magnetic frequencies that I could throw anything at my shoulder, but I wasn't getting better, at least to the point to where I wanted to be. And so what I was not recognizing, that the complexity of my experience, my pain and my movement dysfunction, wasn't just mechanical, wasn't just physical. There was a component that I was not interacting with. And so what Carla brought up at the beginning was this idea of interoception. And I want to share at least kind of the beginning idea of what it is and why we should all be considering this as a component of our movement practice, either if you're dealing with pain or a movement dysfunction. interacting with this component of ourselves is important, because I think by doing so, you better connect with your body. So let me start with something as simple as foam rolling. I'm sure, and I'm using it because most of us are probably familiar with it, of using some type of foam roll, a ball, a stick, whatever it may be, to kind of quote unquote release the body. And so foam rolling as a tool is valid. It's been validated, it's been supported in the literature, but most of us use it as a mechanical tool. We're kneading out the dough, the pizza dough, if you will. We're breaking up scar tissue, fascia, adhesions, all of which is probably, not probably, is inaccurate. But that's what we've been conditioned to think, is that this is a mechanical tool to mechanically influence my body so I move more effectively. Some of that is true, but that's only taking one aspect of our being, which is something that's called exteroception. And so I'm going to kind of define what that is the outer body. So we're foam rolling our IT band, maybe giving us a location. And what you're really doing is you're interacting with the outer body, with the foam roller on your skin that influences that organ, your fascia, your muscles, your tendons, the ligaments. It's interacting with those mechanically. That is true. But it's only influencing one aspect of us, which is the exterior or the exteroception, the outer body. What we're learning is that if we could use the same tool, a foam roller or someone's hands, a myofascial cup, an instrument, whatever we're using to kind of interact with the body to help pain and or movement, we should also start diving in and exploring the experience from the inside out. And so this is what I'm going to suggest you guys start to do. Maybe something as simple as foam rolling is starting to interact with your inner self or your interoceptive system. And the way that you can tangibly do this, and this is something that's been used in some research that is looking at enhancing interoception, the sense of your inner self, to be able to influence pain and movement. And the way that I now I'm recommending to my patients and clients, and I'm recommending to you. So let's say we're foam rolling that outer body, foam rolling your IT band, for example, and you could choose whatever body part. You're starting to paint the picture of your outer body. I could feel this pressure on the outside of my body. I could feel that it's rolling from the knee up to my hip, and you're kind of getting a better picture of the outer body. The next step that I want you guys to consider is to start to dive under the skin, literally closing your eyes while you're doing this exercise and diving under and looking back up to the surface, if you will. So as if you were a scuba diver and you're under the skin and you're looking up at the surface of the water. Maybe there's a boat there and you could see the undersurface of the boat. I want you to add this layer of the experience to your foam rolling or whatever tools that you're using to help yourself. And I want you to start to think about what you're feeling inside. So the things that you should start to kind of add to the experience is, what are you feeling? Does it feel deep? Does it feel shallow? Do you feel like you want to lean into it, or do you want to run away from it? And the key here is not to attach judgment to it, not to describe it in more detail, that you could start to add a flavor to it, meaning that it's good or bad, it's scary or not. I just want you to describe what you're feeling. Is it deep or is it shallow? Is it warm? Is it cold? Like, is the water or the inner environment that you're in, is it warm or is it cold? Do you feel like you want to swim away from that experience, or do you want to lean into it because it feels good to you? Sometimes you might, even with your eyes closed, while you're foam rolling, I really challenge you to try this. Maybe even see if you can sense a color. And there is some evidence to support this, that a color could be associated with what you actually like or don't like. So these are components of interoception that I want you to add to your your regular experience of some type of myofascial, tactic that you use to help yourself feel better or move better, that has been shown to be effective in addressing this underlying component of the experience that we really haven't had a really good handle on, which is this concept of interoception. So I'll stop there, and maybe Carly, maybe if you have any questions, or if you have any comments, or if anyone else has any questions, I'm happy to field some, and I can go in deeper if you want.
Yeah, I guess one comment on the book I was reading, it's do the hard thing or do the hard stuff. I can't remember the bottom word. But they talked a lot about for those who are really well connected with their interoception of their inner self, they have the ability to cope much better. And so like what you're saying, that being able to connect that inner and outer self, if you have a better relationship with that, your coping skills are much better. And they also dove into a little bit of mental health. Like if your coping skills are better, your prevalence of depression and anxiety tends to be lower. Or if you learn how to connect with the inner self, there's usually a better handle on the mental components of what we say like mental health is. Have you found that to be like similar in what you've researched?
Not only have I read it in the research, to your point, that harnessing the skill of getting a better sense of what's happening within, that is a skill that you need to be, most people, I should say, have to train this skill because they're not very in tune. If not, they've been avoiding what they're feeling inside because it's scary to them. There is another category of individuals that are very good at sensing within, and these are individuals that actually can measure their own heart rate without checking it by checking their pulse or having a device that tells them. You could literally count your heartbeats. And I'd be curious if even your followers or those that are listening can actually just sense their own heartbeat. So the answer is yes. The key here is that most chronic pain, most pain experience is associated with some type of disruption to other mental health categories like anxiety, like depression. And by improving this muscle, this inner self muscle, you can actually improve those symptoms associated with pain, which are anxiety and depression. So it's well documented in the literature. I've noticed it in myself that I'm able to better manage when I experience pain now moving forward, even in my shoulder, that I'm not as invested anymore. I'm able to notice what's happening on the my outer body. I'm noticing what's happening on my inner body without judgment, and I'm able to manage it much more effectively, which ultimately decreases the threat. It diffuses the threat associated with it, so I don't add more fuel to the flame, and I'm able to manage it much more comfortably, and my symptoms come down. So that's really important to note here.
And I see some of our like viewers on, but also with patients that you treat, sometimes we see a lot of this like acute on chronic, right? They've had chronic pain, but if something is off, whether it's stress, like family, it's not necessarily like anything physical or mechanical that they went and did, they get this flare, right? So some might look at that as, hey, like you've kind of messed with a lot of your symptoms. You might have had an inflammatory response. So obviously we know that inflammatory responses happen. But in one of the things I've been noticing is if, let's say, stress in people's life, if they're just not acknowledging what they're feeling, or maybe I'll throw a little Brene Brown in here, they don't actually know how to explain what they feel. So a lot of things that like, oh, that's bad. It's like, oh, that's fear. Well, it could be a lot of other emotions. We just don't actually know how to confront that and put a name on it. And so a lot of it is if we can't explain what we're feeling or what we're stressed about, you suppress it down, and it can manifest as like a physical injury or a reoccurring injury. And that's always been something very interesting for me, because sometimes when I treat people, I'm like, well, mechanically, you're good by now. Joint motion is restored, not a lot of fascial stuff going on. And so there's like the deeper component. And I think this is part of how we start connecting that.
I think there's so much opportunity here, especially now that the evidence and I'm happy to share, the science behind it, but ultimately it's learning to communicate to a part of the brain that is modified when we have chronic pain, when we have emotions that we haven't addressed, that this part of the brain, the alarm center of the brain, is really twitchy, meaning that it takes very little to set it off. And when you set off this part of the brain, it's highly connected to our pain network. So to your point, if someone is having a very high stress environment, it usually happens around the holidays as well, when personal and professional stresses kind of collide, that people experience like these symptoms that they haven't experienced all year, headaches, these joint symptoms that they just can't explain. And then that, like I was saying, is that the fuel is added to it because we start to attach significance to it. We start adding significance that really isn't necessary, that adds more threat to that part of the brain that says, my gosh, there must be some real, there's a saber-tooth tiger that's chasing me. I better run or hide or both, right? So the point is that by just learning, and you have to train it like a muscle, to dive in and just experience, just be with the experience and just start to note. And so this is not really indifferent to just being mindfulness, mindful meditation. It's the same practice. You're just learning to do that while you're interacting with your body. So the way that I'm trying to layer this together in a tangible way is that if I'm foam rolling, or I have a therapist working on a specific body part, I'm experiencing what's happening on the outside. My gosh, your hands are cold. That seems pretty deep to me. That's somewhat painful, but tolerable. And then I start to dive in, and then now I'm that scuba diver within my own body, and I'm noticing, man, it's warmer in here than I thought. And I feel like that those cold hands is actually relieving. So I want to lean into it. So I'm going to go more towards the surface. Or, man, that to me is agitating. So I'm going to move away from it. And I'm just noting all of this. I'm not adding any other layer of complexity or judgment to it. I'm just noting. And that has been shown to stimulate this part of the brain in a favorable way to actually to decrease the threat, to diffuse the threat, to extinguish it, if you will. And I use all of these terms with my patients because I want them to think that you're literally just dousing water on this flame in this part of your brain that is partly at fault for what you're experiencing. And I want people to get excited about the opportunity that this whole mindful experience is all complementing to what everyone wants, which is to get out of pain and to help their bodies move more effectively. So just learning to paint the outer body and the inner body better is going to serve you best, I can assure you.
I think that's probably initially scary for a lot of patients. Say you're working on somebody's elbow and that's a very painful part. A lot of times the brain is like, I just need to focus my attention away from there. And now we're asking them to focus their attention on it, go in it, go underneath of it, and dive into it. And I think that'll be a different concept for patients, which I'll start to use because I know, being a patient myself, that's something that sometimes if things hurt, you just try and not even think of that area. You just kind of block that part out, which I know. If you have a certain elbow pain, it starts right here. The longer it goes on, now it just hurts all over here. And it's just this broad area that our brain sort of just collectively says this whole thing hurts rather than that point tenderness. Is that part of the brain's panic system going off there still?
It is. it's your method of managing a threat. Unfortunately, what this does, and you brought up a term of the symptoms diffusing or starting to expand away from the target area, and this is where more global pain starts to really present. And this is an important concept in respect to chronic pain, is that pain starts to move to different areas. It starts to expand or grow, so it's not so focal to like just your hip. Now it's like your hip, your lower back, and your knee. And so the reason that is, and this is what the science is telling us, is that this idea that the more we avoid, the less clear our maps of our outer and inner body are. And this idea of maps is my attempt to kind of make it more understandable, is that your brain, to be able to navigate this body through space, needs to know where my foot is going to be in my next step, right? And so if I'm stepping in my home, I know exactly where my furniture is, where my dogs are sleeping. I'm just looking at them right now. So I can navigate it even with my eyes closed. But let's say I was in your home, Carla, or I'm on the edge of a beautiful cliff and they asked me to close my eyes and navigate the space. My map of that area isn't as clear, so my threat signal goes up. So the point of this discussion here is the exercise that I'm proposing to you and your listeners is by becoming curious about your own body in a safe and effective way. And I'm not asking people to do this, the entire time. Maybe just for 10 seconds of the foam roll experience, I want you to initially start to refine your outer map, your outer body. Say, yeah, with my eyes closed, I know that I'm closer to my knee or I'm closer to my hip. Start there. And that has been shown to start to refine our maps of our body, which starts to decrease the threat. Diving inwards is starting to refine your inner map. And by the exercise is saying, I could feel my heartbeat. My heartbeat is beating at 3 beats every 10 seconds. I could feel my breath. I'm inhaling here and now I'm exhaling. I feel some warmth when I have the foam roller on my body. That is refining the inner map. So by refining the outer and inner map through this curiosity exercise, you actually improve the brain's confidence to move the body, which has been shown to decrease threat and decrease pain. So it might seem scary, but you need to reinforce that this whole exercise is to improve the clarity of your map so you can navigate better, wherever you're moving. So that is what the science is telling us. I'm trying to put it in a tangible way by having people think about outer and inner maps. And then there's one more map on top of there, which is the movement map. And I'm not going to add any more complexity other than saying you could start your movement map, understanding where you are in space, by just, while you're foam rolling, starting to move that body part in a way that makes sense to you. And that starts to refine that third map that is critically important when it comes to our overall health and well-being. So does that make sense? Does that clarify it a little bit more?
Yeah. Does anybody on here have any questions? If anybody has some curiosity in them.
Yeah, curiosity is the key here. So I just turned 50 this year, and I grew up watching Curious George. I'm not sure if anyone can even relate what that even means, but it was this curious monkey that navigated just because he was curious about a shiny, red ball or something that this caught his eye. It always got him in trouble, but he was curious. And so I kind of get people to think, I don't want you to expand your assessment other than what you're currently feeling right here, right now. That's part of mindfulness. Mindfulness is hearing what sounds I'm hearing, what am I feeling, what parts of my body are pressing into the chair that I'm sitting, what is my breath doing. That's all I'm asking you to incorporate into your therapeutic or your movement practice, is to get better in tune to your outer body or your outer map and your inner body while you're doing these. And the evidence, as well as my personal experience, is demonstrating that you can actually see some really cool changes. So that's what I'm recommending.
Awesome. You have a question, Nate?
I just got on here. I got back here or whatever. But to your thing earlier about saying understanding the feelings of where your body is and how if you suppress them enough, there's issues. I went down a rabbit hole here the last couple of weeks on if you do not come forward with like how you're feeling in that, you can have the anxiety, the depression, sleep issues, digestive issues. There's all sorts of things if you don't like get that emotion out that you're dealing with at the moment. So yeah, I kind of get what he's saying all the way across the board, because I'm trying to go down that same path of just getting that out there and getting better, I guess. So thank you.
I really appreciate it. I appreciate it, Nathan. And so that part of the discussion here is just the recognition that we are complex. And I started off our conversation saying we have to recognize that we're not machines, that if we were, the surgical procedure that put my shoulder back together would have been enough, right? And my therapeutic team, as well as my own therapeutic, homework that I've done would have been enough, but it wasn't enough to correct my symptoms and correct my movement, because my nervous system was on high alert saying protect, protect, protect the entire time. And I was only influencing one of many maps that the brain has to be able to navigate the world. So I'm suggesting let's lean on what the evidence is telling us, recognize that we're complex, and start to maybe add some other components of the experience, like diving in and just feeling what you're feeling inside. Here's what I'm not asking. I'm not a psychotherapist. I'm not asking for people to, share their dark secrets or their childhood traumas. That's outside of my scope, but it is a reality that most of us have. And I'll share one resource with you if you guys want to expand your understanding, at least kind of the trailblazer that really started to talk about this idea of expressing what you're feeling within as a management tool for pain. His name was Dr. John Sarno. Was a medical practitioner back in the 60s, into the 60s and 70s. He's no longer with us, but he wrote a book basically focusing on back pain, intractable chronic back pain that does not resolve with traditional care. And his whole goal, and he called it tension myositis syndrome, TMS. And it was kind of disregarded for many, many years because most people in orthodox medicine were saying, no, we have a drug for this, we have an injection for this, we have a surgical procedure for this. But we know that chronic pain is only on an upward trajectory, especially when it came to chronic back pain. And Dr. Sarno really challenged the community and said, some of these symptoms, if not most of these symptoms that you're experiencing are from unfelt, unexpressed emotions. And so he stepped outside of his scope and started asking his patients to express what they're feeling within. And I'm come somewhere in the middle saying, within reason, we can train this inner self by just asking us to become curious of what we're feeling. That might expand into someone breaking down and saying, I didn't have a connection with my family, and I feel that's involved in my pain that I'm experiencing now. I'm going to be now working in collaboration with a psychotherapist to work through that with them. I'm not the expert to work through that with them, but I definitely want them to explore that that's another component of what they're feeling and why. So I'm glad you guys are open to the discussion. I'm here if you guys want to dive in deeper. I'd love to go through, if you wanted to do a follow-up, Dr. Carla, I could walk through an experiential process of this, because I've been sharing this with my patients and clients, and I do that through my education platform. And I'd love to share that with you if you ever felt the need and you felt it would be of service to you.
Very cool. Yes.
Great.
Well,
So you let me.
Yeah. We'll chat about that. I just really wanted to thank you for sharing some outside perspective, which part of this Healthcare of the Future talk is to get people that are not only my members, but people to listen to our YouTube channel to maybe think differently about their health. And when medications, a lot of times people are like, well, medications just aren't working. Well, medications might not be the answer. And sometimes they are. I'm not saying that, but sometimes it's like, how do we think differently? How do we approach things differently to really help our best selves? So thank you for taking your time to be with us today. And yeah, if anybody else has any last minute questions, go ahead and ask them. But otherwise, we'll let Dr. Capo go about his day.
Well, I appreciate you guys. Thank you very much.
Yes, thank you very much. When you stop recording, because I think you have to do it, will you just save it to the cloud?
We'll do that. Stopping.